Pictured here are skin lesions that a person with ringworm may develop on the back, arm, or scalp. Ringworm is best diagnosed by doing a fungal culture. This involves adding some hair and skin scraping material from a lesion that looks consistent with a ringworm infection, adding that material to a tube of growth media formulated to assist with fungal growth and seeing what grows on it. This can take several days to a few weeks. A quick in-office test is the Woods lamp test. This test involves using an ultraviolet or black light in a darkened room to see if the affected area will fluoresce to a yellow-green. It should be noted that not all ringworm fungal infections will fluoresce. Dander or other non-ringworm conditions may also fluoresce, so interpretation can vary. A fungal culture is needed for definitive diagnosis of ringworm. To prevent exposure to ringworm, avoid having direct, bare skin contact with animals that have skin lesions. Use of PPE is one way to create a barrier between people and disease agents spread by direct contact. Gloves should be worn when working with sick animals, animals with skin lesions, or animals whose health status is unknown. This is especially important if your hands have cuts, abrasions, or are severely chapped because areas of broken skin provide an entrance for disease agents. Wearing gloves does not replace good hand washing habits, and it is important to wash hands in warm water and soap after removing gloves. Other disease transmission prevention practices that you can incorporate on your farm are to require or provide clean coveralls for everyone entering animal areas and having clothing dedicated to on-farm use only. In addition, any clothing thought to be contaminated with ringworm should be washed with detergent or bleach in hot water. Various types of equipment can become contaminated and spread disease to humans or other animals. Things such as grooming tools can spread disease such as ringworm, so it is important to wash and disinfect any equipment used on animals, particularly if those animals have skin lesions. The photo from the Center for Food Security and Public Health is demonstrating grooming tool disinfection, and the photo from University of Arkansas Research and Extension is demonstrating the use of alcohol to disinfect ear tattoo equipment. There are no vaccines available for preventing ringworm. The best solution is to clean and disinfect livestock living areas and equipment regularly. Providing adequate space for animals can also decrease ringworm infections. Make sure that animals have access to ample sunlight and keep their areas dry to keep the infection from thriving or spreading once it has begun. Once you realize that animals have ringworm, treating it immediately will decrease the chances that it will spread to your other livestock or to any family members that may come in contact with the animals. Consult your veterinarian about the best treatment for ringworm and management practices that can help control ringworm.